I know for my boss and, for context, our district is, over 270,000 Medicare beneficiaries out of 775,000 constituents. It's an access issue at the end of the day.
A bill to reform the Medicare local coverage determination process may land in Congress this week. The stakes are high as pathologists prepare to meet lawmakers on the Hill. Welcome to the nation's capital. I'm Nancy Johnson, and advocacy leads the agenda for Day 3 of the CAP's House of Delegates and Pathologist Leadership Summit. How Medicare decides whether it will pay for certain medical tests and services may get an overhaul. Representative Claudia Tenney and Representative Nanette Berrigan are set to introduce bipartisan legislation for Medicare LCD reform.
Just making sure that, frankly, our seniors in our district, and I think every member feels this way, has access to those novel technologies, and that we're really incentivizing uptake as opposed to gatekeeping through the LCD process.
Getting in front of these lawmakers and their staffers is critical. Pathologists watched a mock role play of a meeting between physicians and a congressional staffer.
I'm Mike Giuliani. I'm the Senator's Health LA, and look forward to hearing from you.
Hi, Michael. Thanks for having us. And I'm Dr. Justin Fisher.
Oh, I'm sorry. You know what? Unfortunately, our conference room is busy, so can we meet in the hallway?
Sure.
Can we step over?
No problem at all.
Sometimes you just have to roll with it when there's a last-minute change of plans. Pathologists will lobby legislators about the key policy priorities affecting the specialty and patients. Here's what they're asking for: Medicare payment reform, help to address the physician workforce shortage, and fair laboratory and pathology service reimbursement.
If reimbursement goes down and inflation goes up, at some point something's got to give. Either you're going to have to close your practice, or you're going to have to provide less services, or you're going to have to provide less quality of services. You won't have enough physicians to be able to cover what's being provided.
This will be third-year resident Dr. Hunter Koster's first Hill Day speaking with lawmakers.
Though might be some who are a little bit more experienced in the medical field, but for the most part they are not in the medical field, so it could be very easy for them to might get a little lost in the minutia of things, so try and keep things more like a bird's eye view.
Last year's CAP annual meeting inspired Dr. Marcy Crowley, another resident, to make her first Hill Day visit.
And I feel it's important for me as a resident to start early because I feel a little bit out of my depth here. I don't know much about policy. I don't know much about Medicaid, Medicare, and how it's affecting us. So by being here, I've already learned so much, and I'm really excited for tomorrow.
Be sure to tune in Tuesday for our coverage of Hill Day as we follow pathologists on their meetings with lawmakers. That does it for us on Day 3 of HOD PLS. I'm Nancy Johnson. Be sure to follow us in social media for the latest CAP news and updates. Thanks for joining us.